And we're back with Derek Garza. Derek, this is your first time on. I'm sure some people are familiar with you, but for the people who aren't, can you just tell us about yourself?
Yeah, I'm Dr. Derek Garza. I'm a physical therapist and performance coach based in South Orange County of California. This past March, I launched Grid Physical Therapy and Performance. Basically, the goal of mine is, hey, how do I be a staple in my community for athletic development and high quality care? I'm a cash-based PT. I offer remote and online services as well for both rehab and performance. Let's see what else. I studied kinesis, exercise science, and competed D1 at Fresno State. And then I got my DPT at Mass General Hospital, Institute of Health Professions in Boston, Massachusetts. Yeah.
Nice. Yeah, I found out about you just through social media, like a lot of people do nowadays. And then recently I watched your video with Alec Blennis, y'all training together on his YouTube channel. And just with your comfortability and practice of being a clinician, being a strength coach, and how you go about looking at plyometrics, I thought you'd be a great person to come on and talk about kind of the nuances and practicality of integrating plyometrics, jumping, landing, et cetera, all the things for ACL rehab. A lot of clinicians listening, they're longest kind of course of care for their rehabs are some of these ACL related cases where they're going to have to, or hopefully feel confident and comfortable integrating jumping and landing and plyometrics. But a lot of times there's uncertainty and unknown and a lack of practice and education on this topic. So I thought you'd be a great person to talk about it with. Can we just start very basic with kind of defining what actually are plyometrics?
Yeah, absolutely. Let's go into the history a little bit, just because history lessons are always pretty good. Fred Wilt, who was an Olympian and U.S. distance runner, he interpreted it as like an overload of an isometric type muscle action, which invokes the stretch reflex in muscles. So he didn't really like this interpretation. Over time, that kind of changed a little bit. So Dr. Verkhoshansky, he ended up developing the shock method, which would stimulate, the muscles and tendons by accumulating kinetic energy from a free-falling body. So essentially what that means for the rest of us is we're going to make an impact and we're going to rapidly use the stretch shortening cycle in order to improve our explosive power, which mostly is geared towards sport. Right? It happens like no matter what, you can benefit from it. So general population can be a huge benefit, but initially it was looked at like how do we improve sport? Um, so when you get into kind of the actual plyometrics, like what are they? It's a landing to a takeoff moment, right? So that's what we're looking at here with the history and those kind of previous definitions is, how do we move in a way where we need a landing to a takeoff? So let's say a box jump or standing broad jump, those don't really classify as true plyometrics. And here's why. So you want the landing to stimulate your takeoff. You want a ground contact time of about less than a quarter of a second. Anything after about zero point 0.3 seconds, your stored elastic energy is going to start to dissipate, and that movement is going to become more muscularly driven. Now, that part, excuse me, that part's important because for plyometrics, your primary use, the structure of the primary use is going to be of tendons and not the muscles themselves. And the reason for this is recoil, right, which is going to involve your store and release of elastic energy. That's going to preserve muscle energy. It's going to enhance your power output. And then also it's protective because the tendon, it's a stiffer tissue. So a lot of reasons for why that part kind of happens. But that's basically going to be your criteria for what is a plyometric.
And throughout this conversation, we will probably go into different types of plyometrics. So maybe we
Mhm.
start by kind of classifying some of them. There's a lot of ways people have classified them, but I think you're comfortable and you utilize, I think, the tier-based
Yeah,
system. Can you kind of briefly touch on what that means, what that looks like, so when we kind of bring it up later in the conversation, people have an idea of what those are?
absolutely. And I love that because this is essentially how I approach it in rehab or with anybody that I'm working with. But yeah, a tiered system, I use Matt McInnes Watson's tiered system. Matt, a really good friend of mine, another track and field person, but really quick, the language is the same, right? So he's from the UK and from the States. And I also want to give kind of a shout out to Ed Barber and Chris Baptista, some of my coaches that I had growing up. Bob Fraley. Uh, a lot of the plyometrics in the track and field world, it's all the same stuff, and you're taught relatively similarly, right? So coming across Matt's system, it just makes sense from a framework standpoint of, hey, how do I keep my people safe? Right. At the end of the day, that's always our job, is that, and then how do I provide clarity for the person that I'm working with? So using his tiered system, it's 4 tiers, light tier, which is doesn't really require a high level of effort, right? And so there's going to be light ground reaction forces. You're going to have your medium tier, which is not max effort, but it's still very fast. It's still reactive, and you're going to have a reactive ground reactive force. Your ping tier is going to be your max high effort ground reactive force, low ground contact time, long pre-activation phase. That's going into your landing, back to your takeoff. The pre-activation for that's going to be a bit longer. And then deep tier, which is not true plyometrics. They're going to have a longer ground contact time, so typically greater than your 0.35 seconds. Deep ranges of motion, and then it can be intensive or extensive. But yeah, those are usually the four.
Nice. Yeah, I've really enjoyed kind of viewing those four and figuring out where I should start to introduce a type of jump, land, plyometric, etc., and classify it along those four. The context that we're going to go into today is primarily ACL rehab and how clinicians can feel more comfortable figuring out at what timeline should I start to think about introducing some of these things along the way, and how would I actually progress them? So, and we also, I think a good conversation would be, depending on the graph type, would this change your level of volumes, intensities, the type of jumps, etc.? So we're going to dive into all of it. But when you're
Sweet.
going through an ACL rehab within these first few weeks or first few months, what are you looking at for when is it appropriate to introduce a jump or a landing or a plyometric? Are there things you're kind of preparing the tissues for before you start to incorporate like a light tier or a deep tier type of plyo? What's going through your head, and how are you starting that process?
Absolutely. Let me back up a little bit. I love all of this because this is great. And I think this part is probably one of the most important pieces because it's missed all the time. And when I'm looking at adding in plyometrics, it doesn't always have to be in this series, but I'm mostly looking at it from like an intent standpoint into a stiffness standpoint, into a rhythm and coordination standpoint, and then going into speed. Right. And that helps me organize in terms of what am I exposing this person to so that way that they're prepared, going back to keeping somebody safe. What am I looking for so that way I can introduce the tiers appropriately? Right. So everything for me is a spectrum, everything is scalable. And I think once we get into what are our like tissue healing timelines, what are our goals, what is the graph type, that sort of thing, then we can kind of move forward. So ultimately, I'm really not introducing plyos until we pretty much have a quiet knee. Um, I think that part's super important. But in terms of preparation, yeah, there's a lot of prep work that goes into before I even introduce anything, and that's going to be a lot of it's aside from the quiet knee, it's going to be what does their foot and ankle strength look like? Do they have balance? Do they have mobility through the foot and ankle? Are they able to use that really well? And then are we preparing those tissues? And then are we able to get into some form of light impact with stepping patterns? So not necessarily leaving their whole body leaving the ground, but even one foot being anchored and the other one stepping and making light contacts. So we're getting some perturbations in, right? And I think that that part's super important in terms of preparing the individual for what they're doing. And then I do a lot of trunk control, a lot of stuff that's going to be geared toward the pelvis and the trunk. How are we managing shifting weight? So using med balls, using different types of movements that maybe aren't super rotary because I still want to be mindful of the knee joint itself, but the torso is moving. We're still dealing with maintaining or receiving weight so that way that the person can self-organize before I even introduce something like impacts. And then sometimes people will use banded jumps. I don't love banded jumps personally. People use snap downs. I don't love snap downs personally. I just want to throw that out there. So I'm sure at some point I'll get attacked for it, but it's okay. I don't love those things because it changes the mechanics. For a snap down, we don't really land like that. Like that's not we don't really force ourselves down in that position. If you want to use it as a way of getting into and out of a movement, cool. If you want to use them, fine. I personally think there's a better use of other interventions to get a stimulus that I think would go further and I think would be more applicable. So that's kind of my lens. I don't love banded jumps. I think the perturbations and the impacts are great. And when you get into some of the speed stuff and you look into some of the research surrounding that, I think banded jumps can be useful, but in the context of impact, I just think there's too many variables to account for. You're going to increase ground contact time. You're going to like you might be using the band with your upper body to hold on to it. There's just so many other things to account for. And then when I see people doing the banded jumps, half the time the clinician's not really paying attention. So they're relying on the band to do the work versus them using their limb to do the work is just too much noise. So I'd rather cut that out. And then the other one that I've seen people do is lying supine, of course, and then against the wall and then making contacts. And that I think is a very appropriate way to introduce perturbations. But I think looking at it from that lens of, hey, am I looking at the joint below, foot and ankle, or am I looking at the structures below? Am I looking at the structures above when you're getting into the pelvis and the trunk? And then am I building out a way that this person will be more prepared for when we actually get to lights here.
Yeah, so those two kind of contrasting things, like a snap down where I guess theoretically the goal is preparing the entire kind of lower body to feel comfortable or to handle the demands of kind of triple flexion, like bending the hip, knee, and ankle. And then, on that other end of the spectrum, those band assisted pogos or jumps is to just start to incorporate more of those ankle biased kind of elastic and stiffness qualities, and less of like the knee and hip flexion. I think those are typically why people introduce them.
Sure.
Like you said, there's some issues with both for the context of that initial like snap down, trying to have the system feel comfortable, kind of accepting this flexion based kind of position. What are your preferences of how to introduce some of that?
My preference is a lot of it's going to be more on the strength side. It's going to be more on the muscular strength side. And I also think in terms of catching or using med balls or anything like that, I think that's also another way of of doing it where I think it's going to be more beneficial. And it's not that there's anything super harmful about a snap down. Typically when I see it, it's we spend so much time doing them. And then it pushes into the months and months. And I'm like, at some point, are we going to introduce something where we're really going to have an impact on this tissue? I mean, come on here. So that's why for me, it's like, let me just cut out the noise and get into something that's a little bit, I don't want to say it, I'm going to say aggressive, but it's not. So like I said, getting into med ball catches where they're in a split stance and you're throwing it back and forth with a clinician. Maybe we're working on different types of squats. Getting into things where we really want to push some of the strength because initially you want to build out what's going to be protective, and that's going to be the muscle tissue, right? Especially when you're dealing with the graft types, they're still healing at that time frame. They're still healing, so you have that biology there where that's your ceiling no matter what, right? So for me, when I'm looking at the interventions, there's a whole host of them, but it's biology is going to be your ceiling. The art form is going to be us raising the floor so that we don't bump our head against it. And I think some of the other things are just either too low stimulus or there's just they just don't move the needle for me.
Yeah, that initial caveat or priority you said of like the knee needs to be quiet. It doesn't make sense to start to introduce some of these things if you have still a 2 or 3 plus effusion or a reactive 1 plus or 2 plus, and then you don't have full knee extension, or just the fundamentals of those early stages haven't been achieved. And
Yeah.
then, like you said, just starting to touch on the strength and muscle qualities that are very important to begin and to build upon throughout the whole rehab. But if those are kind of plowed through, then how would someone expect like plyometrics or jumping to look and feel? Like, not good. So establishing those early fundamentals is huge. What does it look like when you are now integrating into introducing some whatever it is for you first? I'm assuming the light tier
Yeah.
plyometrics. Where do you start?
Yeah, so the way that the way that I start to introduce it is I'll have a lot of the balance work, I'll have a lot of the strength work, um, I'll have some of the loading stuff where they're catching, might do some of the perturbation stuff. That's kind of my intro of where are they. I'm also going to test, right? I want to know what the quad strength is looking like. So usually when I'm adding in plyometrics, I'm looking at about like light tier, I'm looking at about an 8 to 10 week period. And by then I would have already tested, I would have already gotten some form of number and I would have looked at peak torque. So if you wanted to go by objective testing, I think that it should be a whole series of criteria that we're looking at here. So I'm going to do some objective testing, and in terms of light impact stepping patterns, probably going to be at 1.6 to 1.8, somewhere in that region. Just light impact, like I said, peak torque to body weight ratio. Enter the light tier, I'm probably looking at 1.8 to 2.0. That's your 8 to 10 weeks. Controlled jogging, your 2.0 to 2.6, and then that's it's probably about like your 12 to 16 weeks. And then after that, you're running 2.6 to 3.0 peak torque to body weight ratio. And that's like after 16 weeks. That's what that part's looking like. My other litmus test for this is going to be, what is this person exposed to? How are they looking getting in and out of a car? Do they have stairs at home? Are they going up and down stairs? They got to go on and off curbs. Like there's so many things about life that they're already exposed to. So usually when I start talking about adding in plyometrics at around like 8 to 10 weeks, people look at me like, oh, I don't know, that's aggressive, right? And I've gotten this pushback before of like, I can't believe you're starting that, or what does that look like on the knee? But there's been so much preparation in terms of quad activation and getting the knee quiet and introducing other stimuli that I'm pretty confident in what it is that we're doing going forward. Like, I mean, a lot of content. There's a lot of work going into quad activation. So when I hear the comment about, oh, like, hey, that's aggressive, I'm thinking to myself, well, not getting the quad to activate and expecting, high force, high impact later, that's aggressive. I've actually built this up. I've just done it over a series of time. I've actually looked at a series of things to get us there. So I think that part's missed. When I introduced it initially, like day one, I mentioned this with Jake Tura. I try to make things as non-eventful as I can, like some of the big things that could be mentally challenging for the athlete. I try to dial that back. So for me, I'm saying, hey, you're going to come in, we're going to do all of our strength stuff. By then, I've already built out some dynamic movement depending on the graft type, right? I want to be mindful of what was the harvest site, what's the tissue healing on that, um, what graft are we looking at in terms of like laxity? Was there any secondary injury that came along with it? Maybe is it MCL, maybe is it meniscus, something like that. So I'm gonna also lead into some dynamic movement just to we're building out movement qualities here. The whole thing is, can this person move over time? Like this stuff is gonna take months to years, and I know that. So can we start building in some of these qualities early? And by then we're already into the hundreds of rep ranges, right? So doing that dynamic movement stuff, we've already done some of the light perturbation stuff. We already have some of the balance stuff. We already have the strength stuff. I already know that at home, they're moving around, they're going up and down stairs, they're doing, whatever it is that they're doing. And then they come in and we've been building up strength this whole time. All right, cool. Now I'm going to introduce plyometrics at the end of a session. Nothing about this session changed. They're in for a typical strength and conditioning PT session. Cool. And then at the end, everything's feeling pretty good. Cool. Hey, I'm going to introduce plyos. Go ahead and give me 10 on the spot. How does that feel? Oh, we feel pretty good? Awesome. Let me see you do 10 forward, 10 backwards, 10 side to side. Any pain or anything? And then we're checking symptoms. I'm checking to see how they feel. I'm instructing them on where to make contact on the foot, going right behind the ball of the foot, so mid to forefoot contacts, and keeping it really light. I mean, we're barely moving off of the ground. If you're checking force profiles, the force profile of a light tier plyometric in that regard is no more than what you're doing going downstairs. It's no more than what you have to do to step off a curb, cross a street. So in terms of a force profile, they're already exposed to this, right? Like life is gonna life. It's already applying force. I'm looking at it from the other side of saying, okay, now how can we build on that? So now I'm going to add this in at the end of a session. Cool, go home. We maybe did anywhere between 10, 20 to up to 40 contacts, really light. And then they go home. Then we check in. How was that? Did it blow up the knee? Okay, we're not ready yet. Maybe there's more work that we need to do on the strength side. Maybe there's more stuff we need to be aware of in terms of patellar mobility, in terms of, knee mobility. Maybe there's something else there that we kind of need to tap into just to make sure that we're good. But for the most part, when I've introduced it that way, it's gone pretty well. Versus, hey, this next session that you come in, we're going to start off with plyometrics. Now that's a big event. Now they're thinking about it. Now they're a bit nervous to start. And now I don't know how to dial in some of the volume. I can start and I can lead in that way, but if I blow up their knee in the early session, I just ruin the whole session, and now I'm playing from behind. Whereas I'm not so worried about that in the one where I introduced it at the end because they were already warm. They already went through everything that they already went through. So in the first scenario, I feel much more comfortable and it's worked out really well versus the second.
Yeah. So you saying kind of, let's see how 10 jumps feel. We'll go forward. Maybe we'll go side to side. Are you just talking about kind of double leg, nice,
Double leg. Yep.
springy, light,
Just pogos. Yep.
pogos in
Yep.
place or forward or side to side?
Yep.
You said you're kind of coaching or cueing a little bit of the contact of where the foot is. Are
Yep.
you initially just seeing what their strategy is, or are you kind of starting off by showing this is what I want it to look like, this is where I kind of want the pressure to be? How are you balancing that?
Oh yeah, yeah. I'm coaching them. Hey, this is what I want it to look like. Exactly. Getting right into it. This is how I want it to look. Yeah, you can find out kind of what the strategy is, but I don't want to A, waste their time if I'm going to change it anyway, and B, them to put too much pressure in a certain area. I'd rather give them the heads up, the instruction. I want them to feel comfortable with the instruction and how we're communicating. So I'm going to go right in and lead in with what I want that to look like. But it's everything's going to be double leg to start, but there's I'll do it that way of what I'm looking for, and then later on I'll go into the definitions and what my expectations are. Um, and that's a language thing, and that's to help kind of calm any anxiety or nerves they may have about it. If I go into it with all the definitions and all this stuff, it might be too overwhelming in the beginning. So it's, hey, I just want to see some pogos on the spot, double leg. We're not doing anything too crazy. Let's just go ahead and knock this out. And that's usually worked pretty well. But I've had it done the other way where I've led in with full sessions, and sometimes it is what it is. And some people, it kind of it aggravates the knee. They might feel good in session, which is fine. But afterwards they come in and they're like, I think that might have been too much, you know? Or some people are really strong. Maybe they're on their second or third ACL and they think they're all good and they want to push. Cool. Now we have to kind of push this out a couple more weeks. I don't want to do that. I want to make sure that they're successful.
Two follow-up questions. Can you discuss why that specific kind of placement of the pressure and where they should be kind of thinking about applying force on the foot versus, I guess the other thing, like the whole foot is hitting the ground, or, the forefoot and then the heel slapping, or someone's like really just on their toes? Like, what's your rationale for where you're trying to cue and produce force?
Dissipate forces. One of the main things is what I'm looking at there, a couple things, but it's going to be to dissipate the forces when they land, and it's going to be their ability to be prepared to take off again. If I'm looking at the hill, you're not going to have the easiest of time pushing off if you're landing a bit more flat-footed. It's going to be a little bit harder to do. And then in terms of being really toey in the beginning, that's a lot of force and pressure that's going to go up the chain. It's a lot of compression that's going to happen on that knee. And I don't want that in the beginning. It could be very tendony, but it's still compression. So there's that part of, hey, I want to be mindful of all of this. And so, I want to make sure that they have the control. As far as them landing a bit more midfoot and pushing off of it, if their heel comes down, their heel comes down. I'm not going to be too upset about that. And I'm not too worried about it. Yeah.
Yeah. Okay. That was the first question. And the second, do you really care during those first few sessions, like using the arms for momentum, hands on hips to limit some of that? Do you care?
No.
No.
Mm-mm. No.
Cool.
Get into it. Find a rhythm.
Yeah. So
Hmm.
let's say it goes well. You introduce this at the end of the session. You're making it non-threatening. You're just like, let's experiment. It looks good. It feels good later in the day. The next day, there's no really reactive swelling. The joint's not pissed off. The next few sessions or few weeks, how do you build from there?
Opening it up. It's cool. Now we got that out of the way. The next few sessions, we're adding volume, and now we're adding in directional changes. So now I'm going to lead into, we're still double leg here. So usually when I do any sort of progressions, it's in a series, like a different movement order. So double leg to start, that's going to be your least intense. A staggered stance, still double leg, that's going to be a little bit more intense. Switching pattern, still double leg, it's going to be a little bit more intense than that. One leg to the other, which is going to be your bounding, that's going to be more intense. And then your most intense is going to be single leg, same leg, cyclical. So I'm starting off everything double leg, right? The least intense. But now I'm building out, okay, we're going forward, we're going backwards, we're going side to side. I'm adding volume, but now we're also going to go diagonal forward and diagonal backwards. I want to look at this from a 360 view in terms of how are we managing from a foot and ankle standpoint, and how is our ability to be able to push off and again build some of the stiffness qualities that I'm looking for. And then also, how is the knee handling these different directions and different challenges? Then I also want to build the brakes. That's another thing that I think is highly missed in terms of including plyometrics, is always building in your ability to decelerate. Because like I said, plyometrics are your landing to your takeoff. Deceleration is always going to happen. It's another point that gets missed when it comes to running later. We just think of deceleration as, oh, I'm running and now I'm decelerating at the end when I'm stopping. No, every time you make contact with the ground, there's a deceleration moment. Like that happens. You're making, contact with the ground. So I'm looking at that and saying, hey, how can I add in plyos to help improve our ability to decelerate? And that's usually going to be in the form of like a double leg takeoff going forward to a vertical. So I'm going to go from a horizontal to a vertical because there's going to be a deceleration moment in there for them to even push and go vertical. So we're changing the direction in terms of how we're moving, and that's going to be forward, that's going to be lateral. But I'll use stuff like that. I'll use tuck jumps. I'll use different things to start incorporating what deceleration looks like as my way of an introduction. Some of them can be banded as well in terms of what we're doing. That can kind of take some of the, I guess, some of the unknown away from them because I'm controlling it with the band. I'm kind of holding them with the band, but they still get to feel what it's like to make impact. So there are options, a lot of options.
Yeah, those obviously the deceleration aspect, there's just going to be a much greater knee flexion angle, hip flexion. That is, I'm sure, where you start to maybe notice some of these graph type maybe changes in strategy or just irritation. Like I'm sure some of those light tier forward, side to side, diagonal, if it's still mainly kind of an ankle based strategy and there's not that much knee excursion, maybe all three types are generally handling it okay. But once that deceleration aspect and more knee flexion starts to occur, do you start to notice that a quad tendon or a patellar tendon autograft, those are getting a little bit spicier, or just you have to be more conservative at dosing it?
Yes and no. So I agree, and I love this question because this is the piece of nuance here that's really important. When I'm saying, hey, they're going to go forward and they're going to go from a horizontal to a vertical, we're not talking deep angles at all. We're still very, very, very shallow. Might be getting 30-degree, you know, kind of knee flexion into that. So like it's still in a very shallow, very manageable way. So when we're starting, I'm not too worried about the graph types, but you're absolutely right because that will come into play, especially when you're getting to stuff that is a bit more explosive, that is a bit more demanding, that has higher speed. Absolutely. But in the beginning, speed is down. We haven't even really, broached that yet. So they don't really need those larger joint angle moments. Um, but yeah, when we're looking at hamstring, deceleration is going to be big. So we want to avoid some of the deeper ranges with that. Bone patellar bone graft, absolutely. You're going to have a high anterior knee load during some of those landings. So braking is going to be big. So you want to limit the landings to less than 60 degrees, kind of in that early stage. Quad tendon graft, That one's going to be a little tough. I would delay some of some of what we do in terms of a time frame, and that's just because your absorption, like your ability to just land, is going to be pretty poor. So your deceleration ability is going to be a little delayed compared to the other graft types. And then in terms of your deep flexion there, anything greater than 100 degrees, that can aggravate the graft site. So yeah, when you start getting into the nitty gritty of that, absolutely, those graft types matter. And then in terms of an allograft, because that one takes the longest, and that's going to have a harder time with the revascularization phase, and then building back up. That one, I'm also going to delay what some of the plyometric stuff looks like, just because too much intensity too soon, or too much volume too soon, that can increase the laxity of the graft itself.
Okay, that's good to know about how you're introducing those. The knee flexion angles and the velocities are still relatively low.
Yep.
Okay, so they're tolerating this well. You're introducing and expanding the kind of volumes and the directions, and then introducing some of these deceleration qualities. At this point, are you only dosing this in a session a few times a week? So let's say a typical, patient or athlete may be coming in on the insurance side twice a week. Would you recommend, hey, let's try this on both days you're here? Let's do all the other work in the clinic, some other maybe strength work, the range of motion, whatever it is on your own. But are you having them do any of these, entry level plyos outside of the clinic early on?
No, not necessarily. Yeah, I think depending on if they're in 2 to 3 times a week, that's plenty and high quality volume. I'm good there. As far as what the sessions look like, um, because this has come up quite a bit as well, where I'll talk about plyometrics and we almost get overwhelmed with the topic as a whole. Um, where it's like, hey, like that's the whole session. It's not though. You go into a session, we might do some hands-on work. I just want to see how they're doing. I want to see how the knee is moving from a flexion and extension standpoint early on, especially as we're introducing this stuff. Want to obviously be mindful of swelling, and see how the kneecap is moving. Outside of that, we're back into the dynamic work. We're into some of the plyo work. Everything, like I said, is a spectrum. So we're building that out. The dynamic work is going to move into the plyo work. Then there's going to be some intro to the running work that's going to happen. So we're already building in those qualities. This stuff has been going on for a while now. Now we're building out different, your ability to march. Now we're building out different skipping patterns. Now we're building out different qualities to get you in the positions for that, for what you need to be in when you actually do need to run. Then we're hitting strength at the end still. This isn't like, oh, I only did plyos today for this whole session. No, we've mapped this so that everything is included. We've just restructured the session. In the beginning, I said we did the whole strength session and I added it at the end. Once everything was cool, I flipped the session and now we're building this out in a completely different way. Yeah. So, but they don't need to do too much extra stuff at home unless they're a case where they can't make it in, or whatever it is, they're busy. Maybe they're a young parent, or whatever the case of work. Then yeah, I might have them do the stuff that I know they tolerate well, but we're just looking at quality volume, and that's the part where the art form kind of comes in, where as a coach, as a clinician, you see how the quality of movement looks like in session, and you have an understanding of, I trust them to do XYZ thing, and we're just looking for quality work here.
Yeah, and that doesn't take that much time.
Right.
And yeah, the intent should be there, and then you can move on. So they've introduced and are tolerating the double leg, like light tier pogos in a variety of directions, some of these
Yep.
deceleration activities. You mentioned some of these kind of pre-running drills, or easing into running. Can you touch on what that looks like? And then when you do start to introduce running, how do you implement that?
Yeah. Okay. So with the plyos, everything was double leg, right? Now I'm getting a feel for how they're making contact and how they're popping off of the ground. It's gonna look ugly in the beginning. There also needs to be a point of being aware of that, right? Like, cool, I know that this looks ugly. It's supposed to. This is how it's supposed to look like. There shouldn't be a panic there. It's going to take a while for them to develop those skills. And then you start mixing in some of the other patterns. Right now, we're in that staggered. Now we're switching. Right now we're getting into kind of bound work, and that happens relatively quick. But again, we're scaling. So everything was done really small, really light, low speed. And then you start building out what the height and all of that looks like, what the height and what the speed of that looks like. Concurrent to that, after a certain amount of time, now I'm building in different marching patterns. Now I'm building in, so maybe they have a dowel or a stick overhead, and now I'm just getting them into hip flexion, hip extension. How are we managing just marching and controlling the foot and ankle again? So we're still back to that. So all of these things have been included this whole time. We're all just looking at just volume here. And so now we're doing marching patterns. Are they able to control through the foot and ankle? Are they able to keep their balance? How does their pelvis look when they're moving? Are they leaning with their trunk? What does that look like? What does the control look like? Because that's all going to impact the knee. Cool. So we've done a bunch of marching. Now I'm getting them into skipping patterns. On top of that, now I'm getting them into a dribble series where they're in a cyclical pattern, but it's low. Then we're going to build that up so that it's higher. Then we're going to build that up so that it's higher. And then we're going to blend those. So now we're back to the whole non-event thing where I don't want to make it, really intense or anxiety driven for the athlete. I'm not going to tell them that, oh, hey, we're starting running again. Maybe we're some months in now. And now after we've done different skips and we've done deceleration, and I know that they can handle it, we've started to lean into a little bit of the hopping. And again, going back to the strength profile, objectively testing, cool, I know what their peak torque is. I know what their limb symmetry looks like. I know where we're at in terms of graft and tissue healing timeline. Then cool. Now I'm going to go have them and do dribble bleed. That's usually how I lead in with the running is I'll do an ankle dribble into a calf dribble into a knee dribble, and a bleed is just the blend of those three, usually over a short distance, probably going to be anywhere between like 20 to 40 yards, depending on the person. And we're going to blend one into the other. By the time they get to the end of that, they're basically running. They don't know that. They're doing a drill. So, usually I'll have them work into that. And at the end of it, it's like, hey, how was your first run? And for them, it's a light bulb of, oh my God, like I just ran. So that's how I like to lead into the running stuff. But again, everything concurrent. We've been building off volume this whole time.
For people that aren't familiar or don't know what a dribble means or looks like, I know it's easier to visualize and actually see, but can you describe
Yeah.
like, those three different types of dribbles, how you would kind of look at it, coach and cue, and the rationale for those?
Yeah, so a dribble series, this goes back to usually track and field. A lot of this stuff they're all derivatives of track and field. But a dribble is a cyclical pattern of the foot. So it's when one foot cycles around the ankle or depending on what the name is. So if it's an ankle dribble, it's one foot cycling around the contralateral ankle. If it's a calf dribble, it's still that foot and ankle cycling over the height of the calf of the contralateral leg. And then if it's a knee, same thing. So you're going from from this like cyclical pattern into more of like this oval shape. And it's hip driven. So I know I'm describing it as being at the foot and ankle. That's where you're seeing it, but everything's done from the hips. So you're getting into this patterning of how am I able to flex and extend, and it's very rhythmic in terms of how you're doing it. So that just kind of helps with the patterning of running, just because that's what running is, right? It's this it's this motion of just being in a cyclical pattern and moving off of the ground. And then when you're doing the dribbles, you can teach how they're moving and how they're pushing off the ground. So working back into the foot and ankle.
And dribbles are typically pretty like front side, like there's not a lot of the heel coming back behind the body. Because that hip kind of flexion extension nature, it's mainly just kind of staying in front of the body or kind of straight down, I mean.
Not exactly. Um, You're right. Yes, you're going to be more front side on that. So front side and backside mechanics, if you're looking at a person from the side with the knee and everything going forward, that's all your front side. With the heel and how everything moves through the back, that's all backside. And then together they make the entire stride. Um, but yeah, in terms of the dribbles, you're going to be a bit more front side. But because of the cyclical pattern, you're not pistoning. So you are going to have some translation forward and some translation backwards. It's just going to be more geared toward front side mechanics.
Yeah, it's not like a maybe what people can picture like a high knee where that
Correct.
maybe feels more like a piston kind of up and down, really fast motion. Those dribbles are, like you said, you're kind of coming forward and you're cycling back, but it's relative because you're
Hmm.
still kind of landing right under that foot.
Yeah,
Okay, so they've gone through the dribbles and then they finish kind of their first run
hmm,
and it looks good, feels good. Where do you go from there? How are you starting to build some of the running volumes?
sure. It typically doesn't look good. It might feel good. It doesn't always look good, and this is something that you're going to see. You're going to see that, even if the dribbles look really good, that's going to take time. It's those things are usually pretty hard for the athlete. Just in terms of getting down the rhythm, in terms of pushing off through the foot, uh, that takes time. So it's a while before, it's several weeks before you start looking into, okay, now we're going to make this a bleed. And now, that's going to be your first run. And then also be aware that when you do finally run, you're going to have to decelerate. And there's usually going to be a hitch somewhere where you're not exactly comfortable on that knee. And you're going to notice it on the deceleration. Doesn't mean that it's entirely a bad thing. It's just something you're going to see. And that's going to come with time. That's going to come with practice. Um, and so in terms of volume, I think some of that is going to be a little bit more dependent on your resources, the athlete, the strength, the sport, those sorts of things, on top of what graft type. So, you know, looking at hamstring graft, that's going to take a while just from a strength profile that you definitely need your hamstring, especially as you're getting back into any sort of sprint work. Um, but the volume is going to be highly dependent on a bunch of different factors. So, luckily for me, in some of the places that, I work in when I'm working with athletes, I'm usually working somewhere in between like 20 to 40 yards um, in terms of the space. And I'm just seeing what that looks like there. When I start seeing quality running, then, I might have them hop onto a treadmill. Because, usually we're in clinic spaces. So I'll have them hop onto something where we can accumulate a little bit more volume. Um, yeah, I wish I had like a better answer for that. I know that there's different protocols. I've seen what is it? Like Delaware's protocol. There's a few of them that have these more running based things. I'll get in trouble.
Well,
They're
yeah,
they're cool. They're ultra conservative. It's going to take you forever to build up, running. Here's my lens on it. They're going to do a bunch of distance volume. It's going to take forever for them to even lean into strength, to lean into to force profiles that we're looking at. And that's going to be like a long draw. I get it. You have to check a bunch of boxes. There is objective criteria that you're getting to. You are managing, timelines and the stuff, and that's great. I'd rather build it up on the force profile with plyometrics. I'd rather build it up on the speed side because now I know they have the capacity. So then I'm not worried about the duration later, if that makes sense.
yeah, because I think what you're alluding to, a lot of these protocols or general flows are like a walk jog progression up to, you start at 30 to 60 seconds jog. Maybe you're walking for 5 minutes and you're switching those ratios over time to eventually you're getting to a 20 to 30-minute continuous jog.
Hmm.
That's a pretty typical and common kind of building progression for a run. And in your perspective is maybe not have that long drawn out, it kind of build into a jog, as opposed to your perspective is kind of have maybe shorter distances, keep the quality, build these other kind of outputs, and then down the road, because they have all those qualities, the general kind of endurance and capacity of longer running will come.
Yeah.
Is that
Yeah,
fair to say? Yeah.
absolutely. That because the rest of it, that part will be easy by then. You've already done all the hard stuff. You already have the capacity, and we've built out the strength. Which is the other part about ACL rehab that I see that's kind of in a huge negative is we never build out the strength. We're too busy in a 8 to 12 rep range for forever on whatever the exercise is. When do we ever push anything below 4 reps? And we're really driving strength, and we're really driving, eventually deadlifts, eventually squats, eventually half field squats, like anything that's really gonna move how this person responds and how they generate force. I think once we can develop that and actually push peak torque to body weight ratio, and we actually have, a lot of things, a lot of protocols that go off of limb symmetry. It's like, great, your limb symmetry is cool, but just because your limb symmetry is cool doesn't mean your peak torque is. Your limb symmetry can be a mask for very poor quad strength, right? Especially if you're looking at hamstring to quad ratio. I've seen plenty of those where it's like, yeah, these look even, Yeah, but just because that looks even or that looks relative, that's masking what's actually underneath and what's happening at the quad. So I don't know. I just, my lens is I'd rather be quote unquote what's seen as aggressive and actually drive the strength and actually drive tissue capacity.
So you've built up, or they're now running in the clinic. It's starting to look good, but you haven't introduced some of these maybe more acceleration or top end speed type velocities, and you haven't started to progress some of the more intensive type of plyometrics, or you know, you haven't gone to single leg or more of these ping tier plyos. How do you start to integrate those, and how do you know when it's appropriate?
Yeah, so for a lot of that, they're going to go hand in hand. Your plyometrics are going to go hand in hand with your ability to accelerate and then your ability to hit max velocity. And you're going to know about the acceleration and the max velocity because you're going to see it in the plyometrics. There are direct movements that you're going to be doing that are going to be for the other. And if they can't handle that, they're not ready to handle it when you're really trying to push it in a linear fashion. Um, and then you know that you need to decelerate. So in terms of the timeline, again, this having been a continuum, now you're looking at 12, 16, 20 weeks out. And the reason why it has to be that continuum is because now we're back to the graph type and biology here, um, where we still want to be mindful of that aspect of being too aggressive, where some of those movements for an allograft, we might want to push past that kind of 16-week mark, just for sake of that healing. But the plyos, they can be in a whole bunch of different forms, right? Whether you're doing stuff that's more explosive, and I'm not going to totally like exclude box jumps and stuff in this. Like you can have box jumps, you can be doing depth jumps or depth drops where you're popping off of a box and seeing how they're handling some of those braking forces. Get into different types of bounding. You're going to start off pretty low, and once they have the rhythm of that, you're going to build up the speed, you're going to build up the distance, you're going to build up the height that they're having to cycle the leg around or bring the leg through. And then you can start patterning that with true hopping, which is that single leg action. So those start off as being pretty low and pretty shallow, and over time, those are going to build up to, high moments of you cycling a leg through and going through big movements of hip flexion and hip extension. Once you see the qualities of that, how they're landing, how they're making impact, and how they're able to push, then you can start digging into some of these other things. Now we can get into, reactive strength index if you want to go further into objective testing, and now like, there's force plates kind of everywhere, which can also help, give you a bit more information as to what's happening leg to leg. Um, and those are obviously very useful. But yeah, it's going to come down to what does the movement look like from a plyometric standpoint, and then that's going to drive, you know, what it looks like for you to add in more of the acceleration stuff. But given the drills that we started with, that's all going to go toward, 16 plus weeks. That's you're going to be pushed out. You're going to be at 5, 6 months. Now you're getting to some more acceleration, more deceleration stuff. So it's gonna be a while, um, until you start getting into that stuff.
And then again, with a typical clinician listening to this, they may be seeing this individual, fingers crossed, if they're lucky, still 2 times a week during that mid to late stage. But a lot of people, they're either not seeing them that frequently because insurance isn't going
Sure.
to handle that, or they're not seeing them at all. But in an ideal world, let's say they're coming in still twice a week and you're progressing some of these things. When do you start to, or do you separate, like, this is going to be our lateral, or sorry, our linear, like, acceleration, kind of sagittal plane day versus a change direction? Do you start to kind of create kind of separate days for those?
Sometimes, yeah, I think sometimes and this is great too, because I mean, I'm on the cash based side, so I don't always have the constraints of what that is. But not to say that I haven't worked in that setting. It just has to bring me back to it. Um, but you're absolutely right. So in that sort of case, drive strength. In the beginning, if you're not going to have that much time with your athletes at home, they need to have a sound program where they're driving strength. That's going to be one of the things that you're going to want to lean on, when you're introducing this stuff in session, is that they can handle it. You know that from a strength standpoint, that they're all good and taken care of. Usually when I do strength exercises, I'm usually looking at anterior chain versus posterior chain. So if you want to start breaking up days in terms of what that looks like, and then yeah, when they come in, I'm I might separate, what that part is, and then that's going to lead into what some of the plyo work looks like. But if you don't have that much time, they can do all the strength stuff at home. You're comfortable and confident with that, and then you can see what they're doing when they're coming in. But it is going to be a while. And again, it's not like, oh, hey, because when you look at these protocols, it's like, oh, 12 weeks, we can jog now. No, there should have been a whole, progression. There should have been a whole series of criteria that you've gone through to know that, okay, are we introducing that yet, or do we still need a little bit more time? Yeah, we added plyometrics early, but the reason why we did that early is so we could accumulate volume this whole time. So we're not necessarily jogging at 12 weeks. We're still building up their capacity to start running and doing these things. Um, but but yeah, you got to start looking ahead in terms of what is your time and what's going to be the most sensitive, what's going to require your eyes as a skilled clinician to start making those adjustments. That's going to help dictate what some of those sessions look like.
We could keep going down the rabbit hole of plyos and implementing them, but that would just continue to take hours. So I want to kind of dive into some of the things, and you may have already touched on them. The common things that are you see, you hear, that you just want to speak on, that are common mistakes when trying to introduce and progress plyometrics or running, that you have some kind of pearls or words of wisdom of maybe
Yeah.
clinicians should think differently, or things that you'd recommend.
Yeah. The graph types aren't going to be an end all be all, but you should know what the graph types are. You should know the healing timelines. You should know um, which ones are going to have a harder time with the bone regeneration, because that's also a thing, right? So we need to know how the bone's going to regenerate in terms of healing, and then also the I can't even say that word, ligamentization process. And then other things that kind of pop up, just spikes in effusion. You need to, be mindful of that. Donor site irritation, what does that look like? Um, Early effusion is pretty common, right? Donor site irritation for the hamstring, that's going to be pretty common. Build up some of the strength for that. Be patient um, as far as the effusion stuff goes. This stuff has to be done in a very like comprehensive and well thought out way. Anybody who's been through ACL rehab knows like this is complex. It's not nothing is ever like straightforward with ACL rehab. Um, but back to like deceleration and everything else, that's another thing that I see very commonly, especially with bone patellar bone grafts, is deceleration and kind of blowing up the anterior knee. Compression is going to be the thing that gets the patellar tendon. It's not just the graft, it's that patellar tendon that's still healing. So, deceleration is going to be pretty big. Sometimes I'll separate out, back to the last question building off of that is, yeah, sometimes I'll separate things out in terms of like deceleration session or whatever, and that'll be, included. Maybe we're doing some Excel, so we have to decel. But I can't run my athlete into a ground with just decel after decel and deep joint angle into deep joint angle. That's gonna make the tendons and everything super grumpy, right? So you need to know what volume you're at. This needs to grow in a progressive way. Um, understand the tissue that you're targeting and scale. Everything is scalable, so scale it. And just be patient. Yeah, those are all huge.
Is there anything else that you feel like we should touch on, or big takeaways for this general conversation that you want to kind of summarize or round out before we call it?
Yes, well, I don't know about summarize. And the other thing is do these things yourself. Get experience with it. It's hard to coach it, train it, teach it if you've never experienced what some of these forces are like at all, because you're playing blind, right? And yeah, there's great coaches out there that are older and they don't always continue this stuff, but no, you're a clinician. Get a feel for what some of this stuff is like so you have an understanding of what the result could be. If it's really hard for you, imagine what that's going to be like for the person who just went through ACL surgery, for that person who is doing some of these objective tests and their strength's really low. So get familiar with some of this stuff in terms of going back through or kind of summarizing. um, yeah, I think we can lean into know what the graph types are looking like. Make sure you have a very robust strength program. I don't think starting quote unquote early is aggressive when this person still has life that they have to experience. But if you know the context of this person's life, then that can also help guide what you're introducing to help make them more prepared, make them more robust. Um, and then as far as the jumping and the running goes, those things go hand in hand. They're not full on separate things. You build them out together. And when you can do the jumping in a very controlled way and see what the force looks like and see what the movement qualities look like, then that can help guide what you're doing as far as a running progression. Don't just do drills, don't just copy drills off of social media just because they look cool. Sometimes those things are very specific. So have an understanding of, what drills you're using and why you're using them, and how does that impact the graph type that you're working with.
Do you, for people that feel like they are just skimming the surface and want to dive into this further, do you have any courses or individuals to dive further into for people?
Working on one. So I am most certainly working on one. But in terms of getting a better understanding of um, plyometrics, I'm always going to big up Matt. Shout out to Matt and Plus Plyos. Boo Schexnayder's another great guy, another great resource for all of that. For ACL rehab, there's so many people out there. You guys are an excellent resource. No, I guess just try and be as informed as possible on some of this stuff. I'm going to try and get that information out pretty soon because I think that all of this stuff is pretty important, especially when you get to um, mid to late stage stuff. Yeah, when you start getting into dynamic work, I think that there's not enough information out there. It's kind of lagging. So working on it. I can't say that I have too many because there are very obviously qualified and research backed and all of these great institutions that do all of this stuff. And I just personally see a lot of holes and a lot of gaps. So um, I think they're great. I just think we could do better, especially with the numbers, the injury rates and the return to sport rates. They're abysmal. We got to do better.
This um, is a good starting point, but I think this was similar to like the Q Willie conversation with change direction. It's hard to just listen and take away, like you said, practicing the drills, the activities, actually doing this as a clinician or as a coach and feeling it, and then just getting in reps with clients and patients and athletes is also huge. So,
Yeah.
yeah. All right, we'll call it there. Thanks again, Derek.
Yeah. Thank you.